Thank you very much for staying in for this session, and we really appreciate your time in tuning in. We have learned a lot today. We have learned how spirometry can influence COPD management. As physicians and cardiologists in this audience, you must understand the importance of reading a spirometry report and how to identify a good from a badly performed test. That is so crucial in managing COPD well. You would also understand that guidelines have been available now for the last over 15 years in COPD, yet they are underutilized in clinical practice. So we must use these guidelines, and guidelines on management have also focused on long-acting bronchodilators. Unlike asthma, where we use inhaled steroid, in COPD, long-acting bronchodilators are crucial. Dual long-acting bronchodilators, as you saw through our whole session today, reduce hyperinflation in COPD and therefore improve left atrial size and filling. And so I think that is so important, and therefore cardiac function is improved indirectly with reduction in hyperinflation and dual long-acting bronchodilation. We've also realized that it's so important to recognize the COPD exacerbation. Patients with moderate COPD and severe COPD die of cardiovascular disease, and exacerbation rates also go up of cardiovascular disease, acute MI, stroke, and unstable angina. So recognizing and treating COPD exacerbations early is so important to prevent cardiovascular complications. One more thing is, of course, for chest physicians, is recognizing heart failure. And we went through a wonderful HFpEF score that helps you understand how to pick up heart failure early in patients with COPD. So remember that you must diagnose HFpEF early, otherwise you could be missing an important component of COPD comorbid with cardiovascular disease. And finally, we discussed about the multimodality management of COPD. COPD patients have muscle wasting. They're not able, the poorly nourished COPD patient has a higher mortality, as we know. So improving their nutrition, treating their osteoporosis. They have increased cardiovascular morbidity, and therefore identifying unstable angina and treating it. Treating heart failure early in these patients makes such a difference to their management. And thanks to Professor Usmani and Professor Fogelmeyer, we had such an educative session today, and I hope all of you physicians go back home understanding how to manage COPD well and better, and also their comorbid ailments, especially the cardiovascular component. Thank you very much for your attention today.